Hello. World Epilepsy Day on March 26th is a global grassroots event performed with the intention to increase the worldwide awareness of epilepsy and to dispel the common myths and fear of neurological disorder.
Lavender is country.
The goal of this day is to increase general public awareness, to reduce the social stigma endured by many individuals with the condition, to empower individuals living with epilepsy to take action in their communities.
A person is considered to have epilepsy if they meet any of the following conditions: at least 2 unprovoked seizures occurring greater than 24 hours apart, 1 unprovoked seizure, and the probability of further seizures similar to the general recurrence risk at least 60% after 2 unprovoked seizures occurring over the next 10 years.
Seizures and epilepsy are not the same. Epilepsy is a disease characterized by an enduring predisposition to generate epileptic seizures and by the neurobiological, cognitive, psychological, and social consequences of this condition. Thus, a seizure is an event and epilepsy is a disease involving recurrent unprovoked seizures.
This is how neurons fire normally. This is what happens during an epileptic seizure.
Epileptic seizures are the result of excessive and abnormal neuronal activity in the cortex of the brain. Epilepsy can have both genetic and acquired causes with interaction of these factors in many cases. Established acquired causes include serious brain trauma, stroke, tumors, and problems in the brain as a result of a previous infection. In about 60% of cases, the cause is unknown. Epilepsies caused by genetic, congenital, or developmental conditions are more common among younger people, while brain tumors and strokes are more likely in older people.
Psychological causes. Learning disabilities are common in those with the condition and especially among children with epilepsy. Certain disorders occur more often in people with epilepsy, depending partly on the epilepsy syndrome present. These include depression, anxiety, obsessive compulsive disorder (OCD), and migraine. Attention deficit hyperactivity disorder affects 3 to 5 times more children with epilepsy than children without the condition. ADHD and epilepsy have significant consequences on a child's behavioral, learning, and social development. Epilepsy is also more common in children with autism.
Epilepsy can have adverse effects on social and psychological well being. These effects may include social isolation, stigmatization, or disability. They may result in lower educational achievements and worse employment outcomes. The stigma of epilepsy can also affect the families of those with the disorder.
The diagnosis of epilepsy is typically made based on observation of the seizure onset and the underlying cause. An electroencephalogram (EEG) to look for abnormal patterns of the brain waves. Neuroimaging (CT scan or MRI) to look at the structure of the brain are also usually part of the workup.
Common procedures include cutting out the hippocampus via an anterior temporal lobe resection, removal of tumors, and removing parts of neocortex.
Neurostimulations may be another option in those who are not candidates for surgery. 3 types have been used in those who do not respond to medications: vagus nervous stimulation, anterior thalamic stimulation, and closed loop responsive stimulation.
Diet. There is promising evidence that a ketogenic diet that is high in fat, low in carbohydrates, and has adequate proteins decreases the number of seizures and eliminates seizures in some people. However, further research is necessary.
Psychological therapies and interventions. There is moderate quality evidence supporting the use of psychological interventions along with other treatments in epilepsy. This can improve quality of life, enhance emotional well being, and reduce fatigue in adults and adolescents. Psychological interventions may also improve seizure control for some individuals by promoting self management and adherence. Avoidance therapy consists of minimizing or eliminating triggers.
Purple Day means people everywhere are understanding the reality for people living with epilepsy. So let's spread awareness and show our support to those in need.